Even though the governor paused all of the rollbacks earlier this week, a fourth wave of COVID-19 had been driving up hospitalizations across the state. And yesterday, at the end of our show, I read a text from a listener who is a Tacoma hospital worker, and that person told us that they had 29 people in the hospital with COVID. Their ICU was full. And to be honest, and I'm all about transparency, I immediately regretted reading that text because we hadn't confirmed it. So we wanted to get someone who knows the overall picture of what's going on in our hospitals, and that is Cassie Sauer, the president of the Washington State Hospital Association, and she joins us now live. Good morning, Cassie.
Good morning.
Thank you so much for joining us. So we heard from the governor earlier this week, and we know that I think that we had quoted you as saying we were definitely in this fourth wave. What are we seeing right now in terms of hospitalizations across Washington?
Well, we have definitely seen an increase in hospitalizations across the state, which is very worrisome. We had actually been having hospitalizations decline pretty significantly, and we're down to about 350 people hospitalized, and that was pretty steady for about 5 or 6 weeks throughout the end of February and March and early April. And then suddenly we started to see a pretty fast increase in the number of folks hospitalized, up to more than 600 people hospitalized at a time. And so that's been a really big concern for us. It seems like it may be plateauing right now. The cases are plateauing, and so we're hopeful that may be we might be in a place of turning the corner, which would be great.
That is certainly great news. And just also for clarification, so you went from 350, you saw a dramatic increase, but at any point are you seeing hospitals where they are either overwhelmed or that they're filled or at capacity?
We have a few hospitals that have reached a point where they need to transfer patients out. I think you probably have heard of the outbreak up in Ferry County.
Yes.
The hospitals in that community are pretty small, and they've had to transfer quite a lot of patients out, actually. But in general, hospitals are managing this really well. We have an incredibly cooperative group of hospitals with each other, and so there's a shared agreement, actually a written agreement among all the hospitals that they will help each other make sure that no hospital gets overwhelmed, and that's unusual. And, we saw in New York, in Arizona, Texas, California, where individual hospitals were overwhelmed, and so whether people lived or died and had something to do with which hospital they went to, and that has not been the case here. We have transferred staff, knowledge, medications, equipment, ventilators, patients, personal protective equipment all around the state. Even this week, we facilitated some personal protective equipment transfers up to those hospitals in Ferry County. Since they've had this outbreak, they needed more, and we had other hospitals very willing to give it to them to make sure that they could take care of the folks who needed it.
I want to go back, if you will, a little bit, and then all of a sudden in April it started to increase. What's some of the factors as the reasons as to why? Is it the variance now? Because I even believe that lately there's just been more people here locally that I know of that all of a sudden have been coming down with COVID. What does it seem to be?
Yeah, I think it's a combination of things. I think it's definitely the variants. They are more contagious. They seem to have what's called a higher attack rate, which means they are from the virus's side, their virus perspective, they're more successful at making people sick. So definitely something to be worried about. But the other piece I think is people are tired of. I hear people say, like, I'm kind of done with this pandemic, and I think the pandemic's not done with you. It's not done with us. And I think a sense of complacency about, things got better. And so, maybe I can have a party. In the case of the Ferry County outbreak, we can have a big karaoke event. It'll be fine. I think there's kind of it'll be all right feeling, which I don't think is true. So I think that I really liked what the governor had to say in his press conference when he said, we're pausing the phases, but we want to accelerate vaccination. If this is as your newscast said right before I came on, the state has more supply of vaccines than it has demand. So we are finding this surprises me because I was really eager to get vaccinated. So I couldn't get to the line. When it was my turn, I wanted to be there as fast as I could. And I think that's the case of many people that I know. And then we know some people who just don't want to get vaccinated or aren't able to for medical reasons. We're finding a surprising number of people who are like, yeah, I'd get vaccinated. if a vaccine was available or, if it was easy, yeah, sure. Without, I feel like this has got such strong emotion attached to it for me because I know how serious this disease is. So we're really trying to reach those folks who are in the, I've heard it's hard. I'm going to wait till it's not hard anymore. I want it to be really easy for me, and I'll get to it when I get to it. To say, like, now's the time to get to it. It's easy to find a vaccine appointment. Go get one. Get started. Protect yourself. You can enjoy your summer. You can do so much more when you're vaccinated.
So, and then you said the increase, and then now you're saying that right now there seems to be a plateau, which, by the way, we all agree is a great thing. I mean, we definitely are good with the plateau, and hopefully we start to see a significant decrease. Do the experts and you believe that plateau is because of vaccinations, or people start saying, oh, let me follow protocols a little bit better? What do you think that is from?
I think it's both. More people are being vaccinated, but I think it's also people, we were able to say for many weeks, cases are declining, things are getting better, things are opening up, and the governor was opening, we could go to restaurants and do a lot more things. And I think people felt like, oh, shoot, it's over. And I think with the fourth wave that's come, and not just here, but in other states, people have ratcheted back on their behaviors, which we appreciate. That's the thing about the fourth wave, which we keep saying to people, is like, it is totally stoppable. It is not inevitable. This is not our destiny. We can turn it around in a week or two at the most if people will get vaccinated, wear their masks, keep their distance. We can knock this thing down.
One last question for you, Cassie, and that is, what are you seeing in terms of who's being hospitalized right now? I understand that many hospitals are saying the age group this time around is about, on average, 10 years younger.
Yep. Yes, definitely younger people, including people in their 20s and 30s and even kids. And so I think that's really important for people to realize. Is I hear people thinking that their age will protect them from COVID, that people in their age range haven't gotten really sick. And that's largely true, but it's not entirely true. So there have been plenty of people who've gotten really sick or who have long haul symptoms of COVID, or who even have died from COVID in those age groups. So it's not worth the risk. It's just not worth the risk. And I think as people contemplate getting their kids vaccinated, I've got 2 kids in the age range that's likely to get vaccinated, to be authorized to get vaccinated soon, probably next week. I have a 12-year-old and a 14-year-old, and we're going to be there the moment that opens up. I don't want my kids to, we're seeing more younger people get sick, and I don't want my kids to be in that group. So really encourage parents to think about that as well. And that we don't know if it's a variant, like is the variant making younger people sicker? So it's scary.
Cassie Sauer, president of the Washington State Hospital Association. We appreciate your time. Thank you so much.
Thank you so much for having me. Take care.